Hi, good evening, Mr. Jay Prakash. Hi, Divya. Hi, Aishwarya. Hi, Kotini ji. Hi, Megha. We will wait for another 5 minutes for participants to join, and post that we will start the webinar. Hi, Shubhangi. We will just wait for 2 more minutes for all the attendees to join, and post that we will start our webinar. You can drop in your questions in the chat box. I will be answering all of them post the webinar. Hi, Shubhangi. I think you've raised your hand, so you can just drop in a chat. Hi, Reena. Okay, so I'll be starting with the webinar, and all the questions will be taken at the end of the program. Okay. All right. So good evening, everyone, and welcome to today's webinar on understanding IBS. I'm nutritionist Dhruvi Shah, and I've been working with Daily Bloom IBS as a lead coach nutritionist with a 5+ years of experience in the field. And I'm excited to delve into this topic with you all. Before we start, can you tell me what does IBS stand for? You can put it in the chat box, and there will be a few questions, few MCQs that I'll be asking you all. So I just want you all to answer it in the chat box. Okay. Okay. Yes, it stands for Irritable Bowel Syndrome. Okay, now this is what we will be discussing about in today's webinar. Why does it happen? How to know if you have IBS, the triggers, etc. Okay. So, which of the following is not a common symptom of IBS? Can you again quickly put in your answers? Okay, I think everybody knows. Correct. Joint pain is not a symptom of IBS. The other three are the symptoms that are commonly observed in IBS. So now what is IBS? So let's start with the basics. IBS, irritable bowel syndrome, is commonly referred as IBS and is a gastrointestinal disorder that affects the large intestine that causes variety of uncomfortable symptoms like diarrhea, constipation, bloating, weakness, etc. But it doesn't damage the digestive tract or lead to any serious health problems like inflammatory bowel disease, like Crohn's or ulcerative colitis. So the severity of these symptoms can vary for individual. So now how to know that if you have IBS or not? So the room 4 criteria is used for the diagnosis of IBS. Other ways could be colonoscopy or endoscopy according to what the gastroenterologist will advise. But the main diagnosis are three things, which is related to defecation. Now, recurrent abdominal pain on an average of at least 1 day per week in the last 3 months associated with two or more of these criteria. So either related to defecation or associated with change in stool frequency, or if it is associated in the changes in appearance or formation of the stools in the last 3 months. So now by that, what do I mean? So when it's type 1 or type 2, which is hard to pass, which is basically either hard stools or lumpy stools, that is constipation, and difficult to control, that is type 5, 6, and 7. It is either it is soft, or if it is a mushy stool or a watery stool, that is basically diarrhea. The ideal consistency should be between type 3 and type 4. Next, again, a quiz. So, what percentage of global population is estimated to be affected by IBS? Okay, D. Okay, okay. Anybody else? Okay, there are various answers that, okay. It is only 5 to 10%. So why does IBS happen? So now let's talk about the causes of IBS. While the exact cause of IBS isn't fully understood, but several factors may contribute to its development. Now, first being diet, because diet plays a crucial role in managing IBS symptoms. Certain food that can trigger the symptoms like abdominal pain, bloating, etc. So, common dietary triggers include high fats, high spicy food, caffeine, alcohol, dairy products, and certain types of carbohydrate, which is also known as FODMAP. So FODMAP is basically fermentable oligosaccharides, disaccharides, monosaccharides, and polyols. On the other hand, following a well-balanced diet also includes plenty of fiber, lean protein, fruits, vegetable, and whole grains, which can help alleviate the symptom and promote digestive health. Additionally, a specific dietary intervention such as low FODMAP diet helps with the symptom in the long run. Another reasons could be food poisoning. I'm so sorry. Food poisoning, bacterial imbalance in the digestive gut, or medicines, a long intake of antibiotics or long exposure to antibiotics is something that could cause IBS. Less serotonin. So the gut-brain axis is hampered. Now, when I talk about gut-brain axis, let's know what serotonin is and what role does serotonin play. It is also referred to as happy hormone. So it plays a crucial role in regulating various bodily function, including mood, appetite, gastrointestinal motility. In the context of IBS, lower level of serotonin in the gut can have significant implications. Now, serotonin acts as a neurotransmitter in the gastrointestinal tract, where it helps regulate the bowel movement and the sensitivity of intestinal nerves. Now, when the serotonin levels are reduced, as it is observed in few patients who have IBS, it can lead to dysregulation and gut motility and increased sensitivity to pain signals. The other causes could be abdominal gut motility, which is individual with IBS often experience abnormal contractions of the muscle in the intestine, which could lead to cramping, pain, and change in bowel habits. Nervous system abnormalities. The gut is connected to the brain through a complex network of nerves known as the gut-brain axis. Like I spoke about serotonin. So how serotonin plays an important role in passing the signal. In the similar way, There is a gut and brain axis wherein your brain is sending certain signals to or sending neurotransmitters to the gut, and it is vice versa. So if either if you're stressed or something, it could lead to symptoms that could trigger IBS. Okay, so disruption in the communication of the symptom may play an important role in developing IBS. Then there is inflammation. So a low grade inflammation in the intestine may contribute to certain symptoms and bacterial overgrowth. An imbalance in the bacteria in the gut, which is also called as dysbiosis, may be associated with IBS symptoms, particularly in individual who has IBS-D, which is diarrhea. Okay. Now, what type of a diet is commonly recommended? I think everybody knows about this. So can you all just answer? Okay. Okay. Which is absolutely correct. The low FODMAP diet, like I explained, that helps in managing IBS symptoms. Like I spoke about the triggers, like certain triggers, high FODMAP food. Now let's talk about what FODMAP basically is. So FODMAP are so high FODMAP food are certain food which will cause the trigger, which will cause your stomach to feel uncomfortable and cause these symptoms. So these could include gluten, dairy, onion and garlic, certain fruits, certain vegetables. All these things could cause trigger here. Like there are these example like beans, sorbitol, mannitol, xylitol. So all these are seen in fruits. Certain sugar and honey, all these could cause, these are all high FODMAP food. Onions, garlics, certain other vegetable like beetroot, peas, cauliflower, these are all also high in FODMAP. Certain fruits, dairy products, and carbohydrate food. Now, like I spoke about stress in second brain, like I said that the brain and gut, the gut brain axis, since it is connected, so if at all there is stress, it is believed that IBS is affected by the immune system, which is affected by stress, and 95% of serotonin produced by stomach. So if there is stress, then definitely there will be triggers in symptoms. Now let's talk about FODMAP food. If you all can guess, out of these four, which is a high FODMAP food? Is it mango? Is it bajra? Roti? Is it almonds? Is it capsicum? Okay, I can see a few answers. Anybody else wants to answer? Okay, okay. Okay, so I see 4 and 3 answered. So 4 is a low FODMAP, capsicum is a low FODMAP food, even almonds is a low FODMAP. High FODMAP food is mango. Mango is something which is to be avoided. Bajra, jowar, all the millets are okay to eat. Out of nuts, almond and walnuts is okay. Capsicum, bell peppers are definitely okay to eat. Oh, I gave the answer to the next one, sorry. So now out of these four, I think first, as you all know, is low FODMAP. Out of the rest of the three, which do you think is a high FODMAP food? Onion, carrots, or kale? Okay. Anybody else who wants to answer? Okay. All right. Okay, so everybody has answered the same. It is onions, which is definitely correct. Onions and garlic is something that is to be avoided or eliminated through the diet initially, and then it could be restarted. Out of these four, rice, quinoa, poha, refined flour, which do you think is a high FODMAP food? Is it poha? Is it rice? Is it quinoa? Refined flour? Okay, we got a few answers. Okay. Which is absolutely correct. It is refined flour, which is a high FODMAP food, and hence it is to be avoided. Uh, Next question is, what percentage of individuals with IBS seek medical care and who actually know what their symptoms are or for their symptoms? How many individuals do you think on an average? Over 75%. Okay. Anybody else? Less than 25%. Okay. All right. So the answer is less than 25% of individual. So basically, as you see that people are affected with IBS and they don't think that it is something which they can go and talk to the doctor about, because it is either normal, having bloating constantly is normal. So that is wrong, and that's the reason why Daily Bloom has come up with the program of Daily Bloom IBS. So in this, we basically do diet management, emotional well-being, and yoga asanas. So to talk about the entire program, it is a 14-week program. It has 3 phases, and in the first phase, it is the elimination phase, which is for 4 weeks. That is the reintroduction phase. So first, in the elimination phase, all the food that we spoke about, all the high FODMAP food, is something that is to be eliminated. Once it is eliminated, your gut will settle down a little. Now when your gut settles down a little and then we introduce something in specific amount, we will know exactly in how much amount your body is able to tolerate certain food, and accordingly what we can do is we can include those things in your diet. For example, you know that after doing the reintroduction, after doing the second phase, you know that half a cup of milk at one time is something that you're able to drink. So if you're out or if you are eating at home, you will understand that half a cup of milk is something that is okay. So half a cup of milk or anything based out, or any milk based product is something that I can take during this time in this much quantity, which is very important. And then the last phase is the sustenance plan. So basically, after you come to know about the entire in the entire 10 weeks that your body is tolerating certain food, your body is not tolerating certain food, that's when you will understand what to eat. Otherwise, generally we eat food and we are bloated. We eat food and then there is some symptom. So that cannot go on for a longer period of time. So that's why you understanding how your body works, educating yourself about IBS is more important. Emotional well-being, there are psychologists available, and the nutritionist and the psychologist are available 24/7. So you all can drop in and text with or chat with the nutritionist and physical wellness coaches. And there will be yoga asanas as well. So if you're facing bloating, there'll be yogas for that, or if it is any other symptom, then there will be yoga asanas mentioned. This is something that has recently started, since people don't talk a lot about IBS. People don't know that this is the time to visit the doctor or talk to the nutritionist. So this is something that we have started, that if you know somebody who has IBS, please reach out to them, tell them about the program, or tell them that what they're facing, ask them to visit the doctor, ask them to visit the nutritionist. So just to make it a little more fun, we have added a gift voucher, so that we'll be giving this gift voucher to the patient and whoever has recommended it. So in that way, maybe we'll be able to reach out more people with IBS and help them cure this IBS. So thank you. The panel is open for questions. If you have any questions, then you all can go ahead with it. Okay, there are a few questions. Garlic is required to be taken to prevent from allergies. What can be the substitute? So, garlic is something which is to be eliminated for only certain time. The garlic substitute are a lot of things, like there is dry ginger powder. That is something which is okay to be taken. Garlic, instead of garlic, there are other substitutes, like from allergies. If you talk about, then it's not just garlic, but even lemon helps in it. So that can be a substitute. Okay. If high FODMAP is impacting digestive system, then how slowly adding high FODMAP resolves our issues? Okay, so high FODMAP definitely does hamper our digestive system, but then reintroducing it in certain quantity to understand that how much food your body is able to tolerate. So basically, sometimes your body will be able to tolerate or digest certain amount of food in certain way after cooking it in a certain specific style. So to understand that, we do a reintroduction. Do we need to follow the low FODMAP food plan for the rest of our life to cope up with IBS permanently? Not really. So you will not have to follow IBS low FODMAP diet for a longer period of time. But basically, uh, it is to be started with low IBS. And then gradually, like I said, we will be reintroducing. So you will know how much amount of high FODMAP food to take, and that's when you will understand your body how does it work. If for example there will be certain food that you may not be able to eat, so that is something that you know that you will have to avoid completely, or if taken it should be in a very small quantity. Will it be cured permanently? Can the supplements be taken with this program? Okay, so about supplementation, it is something that the doctor will decide. If the doctor seems that it is fit to take supplement, then yes, you can take supplements along with the program. And will it be cured permanently? IBS is something with either food or medicine cannot be completely cured, but it can be managed up to maximum level, wherein the symptoms or discomfort that you're facing will be reduced, and you will be able to live a better life, rather than having bloating or abdominal pain throughout the day. It would be only when you're eating food which you know are high in FODMAP, and you know that your body is not able to tolerate them. That's Those are the only foods that is to be eliminated. Generally, what duration of serotonin introduced after following diet? Okay, this is something that I can get back to you later. If you can drop in a text message, then that can be answered then, because that it is a little deeper topic to discuss. Okay. What is the difference between food intolerance and food allergy? Okay, so food intolerance is something that after eating certain type of food that your body is not able to digest, your body will either show symptoms like bloating or gas or acidity, diarrhea, constipation, something like that. Wherein if it is food allergy, your body will be able to digest it, but then it will show certain type of allergy in the body, allergic reactions on the body. It could be rashes, it could be acne, it could be anything. So that is allergy. So the test for both of them are also very different. There's another question. In lactose intolerance, will cured completely? If introduced again, will it impact my serotonin level? Lactose intolerance is something which is different as compared to what IBS is. So if there is lactose intolerant, introducing it in certain specific manner is something that could be tried. But if it is intolerance and it is something that your body is not able to tolerate absolutely, then it is something which is to be avoided, and an alternative is something that has to be used for it. I hope all the questions are answered. Okay, if there is anybody, if there are any other questions, thank you, Divya. Could you suggest a few ways to include high protein food for a vegetarian low FODMAP diet? Okay, so a very good question. So for protein, it is basically all the lentils. Lentils is something that can be included. It can be low FODMAP milk, which is either almond milk or soy milk or coconut milk. It could be curd. The lactose free curd is something. Tofu is something that can be taken. So all these are high protein food, and you can have it in a low FODMAP diet. Almond is something that can be included. Even buttermilk is something, lactose free buttermilk, that can be included. How should one manage without medication when IBS is flared up even after following low FODMAP? So low FODMAP food, when it is started, it is not something that will cure within a week or within 2 weeks or within 10 weeks. It takes time for your body to settle and understand how it is functioning. So I would say that you need to understand your body, and it would take certain amount of time. Once you know how your body is functioning, and then it can be cured. It cannot be in a day or two. Okay, so one last question. How about person having anxiety, depression in last 10 years will be fixed with your course? How's your experience? So I am a nutritionist here with Daily Bloom IBS, but about anxiety and depression, I think a psychologist will be able to tell you well. Yes, they will be there throughout to help you out with whatever issues that you're facing. So yes, it will your anxiety, depression. It will help. Okay, I think there aren't more questions. All right, it was good. I hope you all understood, and there was a message that you were able to take back from the webinar. If there are any other questions, anything, you all can mail to us, or you can, if there are any topics that you all want to discuss about, if you all want to know about, you can drop in the chat box, and we will be able to take it up in the next webinar. Thank you all for joining.